morning, good afternoon, good evening everyone. Nasa man po kayong parte ng mundo. Welcome to the 116th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and for all those who have just discovered us today, welcome po at sana po marami po kayong matutunan sa webinar po natin ngayon. For our webinar, we tried to ask, why do some people experience bothersome symptoms of COVID long months, even years after they are infected? There are reports of people who suffer silently, not even realizing that their chronic problems are related to their previous COVID-19 infection that occurred months before. So what do we know about long COVID, also known as long-haul COVID, post-acute COVID-19, post-acute sequelae of SARS-CoV-2 infection or PASC, long-term effects of COVID and chronic COVID? So post-COVID conditions can be continuing or ongoing, and these can last for weeks, months, or even longer. For today's episode of the Stop COVID Deaths, we will dive deeply into long COVID and learn what you can do to stay safe. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. I also look forward to Fridays because I get to share hosting duties with our adjunct research faculty at the National Telehealth Center. Also, international renowned public health communications expert, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. To everyone, saan man kayo naroon, we're very happy to have you here. I'd also like to greet people who are on the playback watching us after the webinar. But I understand, Raymond, we've got a lot of people on Facebook, and we also have folks on YouTube and on the live stream. No? So we are very happy to be here, and as usual, we bring you the best experts to talk about long COVID. If you've noticed in the beginning of our webinar, we had a opening billboard, which said, "Stop COVID deaths," but the C stands for continuing COVID concerns. And so today we are tackling COVID again. Balik tayo doon. Kasi minsan nag-iba-iba tayo ng topic, pero hindi natin binibitawan yung conversation on COVID. No? COVID, and then O for other outbreaks, and then V for viruses, I for infections, and D for disasters. So we are going to talk about long COVID. Very, very exciting, interesting discussion. And as always, we've got the best speakers for you, and we'll have a very, very interesting conversation. Sana marami tayong lahat matututunan. I know you're looking forward to that. And for those of you who have questions already, you can put it in the in the Q&A box. Lagay nyo na. Kasi para yung speakers natin may ideas sila kung ano yung mga interest nyo. Anyway, we all know that you are very, very keen on getting the latest news and updates. So we have a new section in Stop COVID Deaths called the News Update.
For our first news update for today, we will be talking about a new malaria vaccine which has been described by scientists at the University of Oxford as world-changing. The team expects it to be rolled out next year after clinical trials showed that up to 80% protection against the deadly disease can be given po. And critically, their vaccine is cheap. Mura po ito. They already have a deal to manufacture more than 100 million doses per year. So the charity po, I think this foundation is Malaria No More, said that recent progress meant children dying from malaria could end in our lifetime. So talagang very, it's a game changer, kumbaga, with regards to how we could protect everyone from the deadly disease po called malaria. Dr. Susie?
Yeah, in the news naman that I have, Raymond, long COVID is linked to suicide as a hidden crisis. The scientists at the National Institutes of Health in the United States and the UK are studying the links between long COVID, suicidal ideation, as well as depression. There are questions about whether this is because of the effect of the virus on the biology of the brain, or whether long COVID just pushes people to the brink where they feel they have no other options. Suicide is also linked to chronic pain disorders as well as inflammation of the brain, both of which are also found sometimes in long COVID. So that's our news for today. And next Friday, we'll come back with more news for you on the news update. Okay, tuloy-tuloy tayo, Raymond, no? According to the US CDC, post-COVID conditions are found more often in people who had severe COVID-19 illness. But anyone who has been infected with the virus that causes COVID-19 can experience post-COVID conditions, even people who had mild illness or no symptoms from COVID-19. And according to the CDC, in some instances, the patients may have never tested positive for COVID. Unvaccinated people seem to be at a higher risk of developing post-COVID conditions compared to people who were vaccinated and had breakthrough infections. And we'll hear more about this from our guests and the effect of long COVID on mental health and suicide risk. You know, Raymond, when we were writing this, we put this in, but about 9 hours ago, that news that I just read came in, just really talking about mental health and COVID and increased risk for suicide. So other kinds of psychiatric symptoms like depression, anxiety, PTSD, and cognitive impairment or brain fog have also been noted. So we're not sure really what to expect from long COVID, although there are trends and people are studying many different aspects of it. So Raymond, I think we're going to listen to what people are saying on the ground.
Thank you, Dr. Susie. So, for those who are joining us for the very first time, we try to set our discussion into context by presenting just a very short video that was produced by our team at the Stop COVID's webinar series po, no? And this is just to get the pulse of the common folks on the street for a particular topic and their answers to a particular question. So, for this Pat's interview, the question that we pose our interviewees is as follows. Ano po ang pagkakaintindi ninyo sa long COVID? Sa mga kilala po ninyong nagka-COVID na, ano ang karanasan nila patungkol sa pabalik-balik na sintomas? Please watch this.
Personally, wala akong exact na kaalaman tungkol sa long COVID and hindi ko rin siya ni-research. Ang naririnig ko lang about that is yung mga nababanggit sa tabi-tabi.
Hindi ako masyadong technically versed sa kanya, pero alam ko na parang multiple times kang magkaka-COVID. So parang ganun ang kahit na nagka-COVID ka na at supposedly immune ka na or bakunado ka na ay magkaka-COVID ka pa rin.
I think po yung long COVID po is yung mga paulit-ulit po na symptoms. Like, for example po, nagka-COVID na po yung tao and then bumalik na naman po yung symptoms niya. Then, paulit-ulit lang po.
Yung long COVID, oo, nakita ko rin din online yung parang yung symptoms nun, madadala mo yung symptoms na yun after yung first bout mo with COVID.
Marami akong nakilala na nagkaroon na ng COVID. Siguro dahil nga tumaas na rin yung vaccination rate ng mga tao and kahit na patuloy pa rin yung pag-evolve ng virus, nagkakaroon na din tayo ng somehow immunity doon.
Sunday nagsimula yung symptoms ko. Akala ko usual pagod lang dahil lumabas na kami. Tapos Sunday, Monday, Tuesday, hindi pa rin siya nawawala. So naisip kong magpa-antigen test. Confirm na may COVID ako nung time na yun. Yung ano lang, hindi na naulit yung body fatigue, tapos yung bigat sa katawan.
Wala naman po akong kilala na nagkaroon po ng long COVID or COVID, especially po sa mga family ko po and friends po.
May mga kaibigan ako nagka-COVID na at may ilan din sa kanila na nagka-COVID na ay kumbaga in a matter of months ay nagka-COVID ulit. Tapos after bakuna, nagka-COVID ulit. So, nung nagkaroon sila ng COVID, actually, ramdam talaga nila yung symptoms. Parang yung iba kasi asymptomatic, pero yung marami sa malalapit na kaibigan, talaga nawawala ng panlasa o nilalagnat talaga ng malala. Tapos, yun, kumbaga yung lahat ng symptoms halos nararamdaman nila. Hindi ko pa masasabi kung talagang threat siya, pero um, dapat pag-ingatan pa rin. Diba?
Yes, thank you so much, TVUP, for that. No? I think, Raymond, it's really great to get a sense of what's happening on the ground. And I think our audience, especially, all of our frontliners who are listening to us now, you're in a very good position to give more information about long COVID, especially after we listen to our excellent speakers. So sometimes kailangan talagang itulak natin o we trickle down the information because people may not know that they are suffering from something that was related to a COVID infection. Raymond, over to you.
That's true, Dr. Susie, and hopefully our webinar will be I mean not really go viral but will be disseminated widely para po mas marami pa po ang makaalam na meron po talagang kondisyon na tinatawag na long COVID. But before we go to our webinar proper, just a few housekeeping. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have sent out completely for webinars 1 to 114 all of the certificates po, and hopefully we will be finished with webinar 115 over the weekend, and then also if we can completely send out certificates of attendance for webinar 116, which is for today po. Okay, so we will be following po a little bit of unorthodox kasi we want to be able to get a sense of how the patients really, those who are experiencing long COVID po, we want to get a sense of that before we go ahead with the scientific po, no?
Oo nga, Raymond. What we're going to do is we're going to introduce to you somebody who has experienced long and is still experiencing long COVID, no? Para marinig nyo talaga yung perspective ng pasyente na hindi natatapos yung kanyang yung kanyang kalbaryo from COVID. So we're gonna have a different kind of a discussion from that point of view, but we'll still have the standard panel and all of the other fun things we do, Raymond, right? Go ahead.
That's true. And before we forget, and this has already been mentioned by Dr. Susie, yung Q&A session po will follow right after our discussion. So we really encourage everyone, if you already have questions, to please put them in the Q&A box in Zoom and in the comment section of Facebook and YouTube, especially for those who are joining us outside of the Zoom. We will be scanning all of those, and hopefully we'll be able to identify which ones would be posed as questions po to all of our speakers. But before we delve into our webinar, we have our very cute intro video for our fun quiz segment. Take it away.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Wala pa tayong paa dyan, Dr. Susie.
Oo nga naging saranggola. Nako talaga, nakakatuwa naman. O sige, game. Let's go to your question.
Thank you so much. For those who are in the Zoom, you'll be able to see the 3 questions that we have for our fun quiz for today. But for those who are joining us in YouTube or in Facebook, you can join and you can participate in this fun quiz by opening up your internet browsers and typing in slido.com. And when you are prompted, please enter the code 5405717. That's 5405717 for you to be able to join our fun quiz. For the first question, a case is considered long COVID when ang options po natin ay 3. Symptoms persist 30 days after the deemed recovery. Number 2, bothersome symptoms, cough, breathlessness, brain fog, etc. persist regardless of time. Or option 3, hospitalized for more than 2 weeks. Ano po ba doon ang long COVID? So, we are seeing a whole lot of our attendees, at least a third na po, no? typing in their answer. So hopefully we could get them to, most of our attendees to join our fun quiz. But before we go to question number 2, we'd like to greet those who are joining us from Pangasinan State University in Lingayen, Pangasinan, from James L. Gordon Memorial in Olongapo City, the Antique Medical Center attendees po in San Jose de Buenavista in Antique, Cebu Provincial Hospital in Car City, Cebu, and Dr. Jose Rizal Memorial Hospital in Lawaan, Dapitan City. Meron din po tayo nakikita, joining us, Dapitan City Health Office. Maraming salamat po. Those who are joining us, especially po with regards to, from the education sector, from UP Diliman, again, from Southern Philippines Medical Center, maraming salamat po sa inyo. There are also those joining us internationally. Mamaya po we will greet you. Our regulars from the Center for Kidney Diseases of the University of Santo Tomas Hospital. Maraming salamat po sa inyo. We also like to greet those joining from Pasay City, from Car Sigma District Hospital, from the Quirino Memorial Medical Center Laboratory. Maraming salamat po sa inyo. And those who are joining us, especially po with regards to, sana po ito, UP Manila and LPGHSTC. I'm not sure kung Las Piñas General Hospital po yun. I'm just guessing po. No? And then those from Cavite and from RPHS, I think is from Rizal kasi Annex 1 in Antipolo po. Maraming salamat po sa inyong lahat. For question number 2, how is long COVID managed? Option A, short course of oral steroids. Option B, cyclic antibiotics. Option C, rehabilitation. And option D, antivirals. So we know that there are those who are joining us from University of Hail in the Kingdom of Saudi Arabia. Those from the Faculty of Medicine in Travin University in Vietnam. I think that's the first time that we've had them in the program. Chonin Hospital, Taipei City, Taiwan, Dubai, United Arab Emirates, and the University of Fiji, Lautoka in Fiji. Those nagpapag-greet po from Jose Rizal Memorial Hospital, Dapitan City. Maraming salamat din po. And then for our last question in a fun quiz, only severe to critical COVID patients get long COVID. Ito po ba ay true or ito po ba ay false? We will not be closing po our fun quiz and we hope marami pa po ang mag-join at mag-participate po sa ating fun quiz. And we hope that yung pong mga kasagutan will be able to get the right answers towards the end of the webinar po kasi. So we hope you'll be able still to join us so that you know the correct answers to these 3 questions. Now, we will move on to our webinar proper. Dr. Susie?
Okay. Wala yung camera ko, Raymond.
No problem. Ayan, there we go.
Okay, here we go. Okay, so I know that everyone is excited to get this discussion on the way. So let's introduce our first speaker, who is an award-winning journalist. We said we were going to bring in somebody who has experienced or is experiencing long COVID. He's a journalist of the Philippine Star, and he's written about his COVID-19 experience in his column, which has garnered the Catholic Mass Media Award for Best Opinion Column twice. Please, let's give a warm virtual welcome to Mr. Büm Tenorio Jr. Boom, welcome to the webinar.
Hello.
Uy, palakpakan naman, palakpakan.
Yay! Oh, it's in the form of emoticons, Sir Boom. If you can
Oo, yan, makikita mo na Boom yung mga palakpakan. So, Boom, welcome.
Thank you very
Welcome.
much.
And yeah, sige. So first tell us about yourself. The audience is really keen to know a little bit more about you personally. They know you're a writer, but tell us a little bit more about yourself and then tell us about your bout with COVID.
My name is Büm Tenorio. I'm a journalist by profession. Under normal circumstances, I would have opened my self-introduction by singing, but I won't be able to do that now because my voice has been hoarse for the last 1 month. Because as a side effect of COVID, I'm having long COVID now. I have intermittent coughing, so I cough. I consult with my doctor every 2 months because I cough. So in the process, I had laryngitis, I lost my voice. So it's been a month that I've been hoarse. So what else is my experience with long COVID? My memory is diminished by 0.001%, but of course the calculation is all mine, just to illustrate that my memory is diminished. I wrote about my column 3 weeks ago, still feeling the effects of long COVID, because of an experience I had in school. I also teach every Tuesday in a local college in Kabuya, where I am really from. I teach in a local college in Kabuya. So one Tuesday, I went to the school and there was a line of students doing the enrollment. One student greeted me, "Hi, sir, good morning." It was 10 a.m. Let me fix my camera. Yeah. It was 10 a.m. He greeted me. So I was totally blank. Who is this guy? Why is he greeting me? Was he my student? I pretended that I knew him para hindi siya mapahiya at para hindi rin ako mapahiya. So ko, "Oh, hi. You were my student, right?" He said, "Yes, sir. I gave you a high grade, right? Because I give high grades." "Yes, sir." And then he mentioned, "I enjoyed our eulogy in the last discussion." So I figured he was my student in one class. And I said goodbye, but I was distressed. I was telling myself, how come I can't remember his name? He was my student. So I went to the car. My brother was driving for me. My brother told me, "Why don't you look at your records?" I challenged myself. I didn't look at my record book. I didn't look at our group chat. The whole day I was just challenging myself who this guy was. I was remembering his name. Remember, I saw him at 10 a.m. And then I remembered his name at 11 p.m., 13 hours after. His name was Andre Caballero. And I asked myself, how can I forget Andre Caballero when in fact, he was one of my favorite in my class because he was one bright student. I gave him a high grade. And then all of a sudden, I remembered everything I told him. "Oh, Andre, please don't come to class late. You come to class late because you don't sleep at night at all." So these are the things. Today, just one illustration again. My friend Rachi Kuna called me. Oh, how nice. He just mentioned keywords, Christine Lim. The paintings are good. This was on the phone. So I said, "What? What paintings?" And he just said, because he knew I have long COVID. Sabi niya, "Hi, here we are again. Your column today." Can you just imagine my column today? I forgot I wrote about him. I mean, it's not every day that you remember what you write about. But this is fresh. It's today. My column is every Friday. Oh yes, I wrote about this artist missionary named Christine Lim. So these are the things that I experience. It's distressing because I'm a journalist. I should be known for my accuracy, and journalist has accountability, responsibility. And I write what used to take me 1 hour and 30 minutes to write now takes me about 3 hours, sometimes the whole afternoon. And while I'm pounding on my computer, there are words that I just cannot remember. When it used to be that words just come out of my fingers onto the computer screen. Because I would like to believe that before I suffered from long COVID, words would just be there. Words for a writer like me are my friends. They are my allies. They are my sanctuaries. I just type and type away and everything is in my brain. But this time, when I wrote my column about my long COVID, I mentioned there a classic example. just to remember a certain word, I had to stop. And I was just looking for the word acupuncture.
Mm-mm.
And I was bothered because it would happen every day. I mean, it's not that I forget it totally. But my being quote unquote forgetful, they call it brain fog, is there. It's real. I just would like to believe sometimes. I mean, I'm talking to myself many times. Baka nag-iinarte lang ako. Baka maarte lang talaga ako. I'm just acting up. No, but it's real. There are days I wake up in the morning that I don't have a sense of smell. Take note that I lost my sense of smell when I had COVID. I battled COVID in July 2021. So it's been 1 year and 2 months already, if my calculation is correct.
Mm.
So that will be a long time.
Correct.
But when I had it in July, August, September, sometime in October, after 3 months, was the only time that my sense of smell came back fully to me. How did I do it? I had acupuncture at Sonia's Garden. I had acupuncture for 1 week or 2 weeks. And then slowly, I began to smell things, flowers, even the smell of olive oil. But 1 year and 2 months after my dalliance with COVID, there are mornings that I wake up when I cannot smell anything. Should I blame rhinitis for it? Maybe, yes, according to a pulmonologist. But when I experience rhinitis, I would not smell something or I would just sneeze. But my sense of smell would come back right away. But there are mornings when I wake up, I don't smell anything, and it would last for 3 hours. You have to understand that I'm a lifestyle journalist. I also depend on my olfactory membrane because sometimes I have to review food. I have to smell it. Or sometimes I have to go to a particular hotel. I have to describe the scent. It's called color reporting. But many mornings I don't have my sense of smell. And one doctor, I talked to one doctor in St. Luke's. She's the memory. See, my memory. This is a classic example. I should know because I wrote about it, but now memory center. Yeah, memory center. See, I'm just looking for the word center, and it took me a while, maybe 15 seconds to remember it, or 10 seconds. This is a classic example of what I'm telling you. When words used to just come out of my mouth quite easily, now I have to think about it. So the doctor told me, her name is Dr. Jacqueline Dominguez. She told me about the phantom smell. The phantom smell is when you don't smell anything at all, or pre-COVID, I really have a heightened sense of smell. My sense of smell is very keen. But with the long COVID, many times I smell malodorous things. I bike a lot. I bike every day. I bike for an hour or 2 hours. The most I bike for 14 hours a day. When I bike, I would pass by flea markets. And many meters away from me, say 10 meters away from me, I can already smell fish being mongered. Yung mongering is the term for when you pag nilinis yung fish.
Nililinis, kinakaliskisan,
That's
yes.
mongering. So I can smell fish being mongered. And I'm 10 meters away. So I would bike past it and I would know the fish vendor was mongering fish. or far away from me, because I bike in Cabuyao, Laguna to the scenic spots in Calamba, Calauan, up to Pagsanhan. So in a scenic spot, I would smell tires being burned, but the tires being burned are nowhere in sight. Lo and behold, after a few meters, meron nga. I'm a solo biker. I'm a solitary biker. I got my COVID, I think, while biking, because there was a time that Better Bike Philippines, a Philippine bike company, tied up with me to give away 100 bikes, but I only reached up to 30 bikes. I was giving it away to, that was my advocacy. I was giving bikes away to factory workers in Metro Manila, or workers who walk to their workplaces because mahal ang pamasahe. So that was my advocacy. I was giving away bikes. It was in the process of giving away bikes that I contacted also the virus. Oh, I stopped it because my doctor told me to stop it. That was the surge of Delta at that time. So I stopped it. So when I bike, maybe I'm jumbling from one topic to another, because now there are so many things in my brain. I'm so afraid that if I don't blurt it out, I might forget them. Oh, biking. So when I bike, I smell things. But also something happened to my biking. From Cabuyao, my hometown, to Pagsanhan, Laguna, would take me about, that's about 50 kilometers in distance. I'm a leisure biker. I'm a solo biker. I go very slow on the road. Maybe the fastest is 10 kph. If that's the way you measure it. So it used to take me about 3 hours to get to Pagsanhan. Pre-COVID. I mean, pre my COVID journey. Now, I tried it once, July 2020. I went there sometime in April or May. It took me more than 5 hours, maybe 5 hours and 30 minutes. And what used to be 2 stops to go to Pagsanhan from Cabuyao is now 5 stops. Do I get tired easily? No. Pero nakakaramdam na ako ng pagod. Is it age? I'm only 50. Is my memory affected by age? I asked the memory center doctor. Sabi niya, at 50, no. I asked my mom if we have history of dementia, Alzheimer, none. In fact, I would like to believe I'm like my mom or my father. My late father also had a very great memory. My mom also has very great memory. There's no history in the family of forgetfulness or anything like that. Sometimes I'm vague. Yeah. Sorry.
Yeah. So Büm, thank you so much for sharing. I think you've really described in a very detailed manner. And if you look at the chat, a lot of our audience are disclosing, also saying what they have experienced. You can see it now. But then I want to sort of move our conversation a little bit more from what happened to how do you feel about this? What is this situation? What is its effect on you? So we can see exactly what happened, and you've described it really so well. And again, look at the chat now. You can see our audience talking about their own experience. So you're not alone. I think this is the most important part. No, you're not alone. Others are experiencing it. So you're talking about it in your column was very, very important, because once you came out with it, it affirms what other people are feeling. Now, what you're experiencing, but what are you feeling What is this doing to you?
Dr. Susie, I have always been brave. I came out as someone suffering from long COVID because I want to be able to reach out also to other people. I don't see the chat box. I'm a technological twerp. I don't know technology that much. I don't know how to open it to read the messages. But yeah, it's good that people are reacting, disclosing themselves. I just want to be able to help a community.
But describe your feeling. What are you feeling right
To be
now?
very honest with you,
Yeah.
it's depressing at times. Depressing because there are many moments that I grope for words or for the simple name of the occasion I attended, I forget. Distressing because I'm a journalist. My memory should be sharp. It's still sharp, but it's diminished. Yesterday, I was in PGH. I joined my friend in an outreach project in PGH at the Cancer Institute. We were there with the children with cancer. I was interviewing Dr. Joey Ignacio. He's the head of the Cancer Institute, if I'm not mistaken, in UPPGH.
Correct.
And many times I would have to ask him, pardon, come again? Because hindi siya nag-register right away.
Mhm.
And now I resort to my phone to record. If may I flex myself, when I started as a journalist in 1995, there were times I did not use a recorder and I did not even take down notes. I interviewed personalities without notebooks, without tape recorder. Because the training in journalism is sometimes the subject does not want intrusion. So the minute they see a tape recorder, the minute they see you taking down notes, they get to keep to themselves. So we are trained to remember everything by memory. So our brain should function all the time. So old school ako. So nag-i-interview ako ng walang recorder. I remember everything. Everything is just in my brain. But more so now, I have to use a recorder. Because I would like to believe I'm a respectable journalist and my words have meaning and my words have impact and my words should be accurate because journalism is all about responsibility, accountability. I mean, I'm not a blogger or what do you call them? Because they don't have sense of responsibility for crying out loud. But I have a sense of responsibility.
Mhm.
So I have to take care because this is my craft. So I'm distressed because I get to a point that I become anxious because you have to remember that my bread and butter are words.
Yeah.
And these are words that what else? Ang bagal ko lang like sometimes
Boom, how has it affected your sleep? You mentioned it before.
yeah, my sleep. Okay, that's another thing. In 2018, just to give a backgrounder, I had a sleep problem. I consulted the sleep doctor who really treated me for a month or two. And then my sleep was regulated. Balik ako sa, I could sleep at 10, 11, ganyan. But now, after my COVID, I noticed that my sleeping pattern has changed. I now sleep pinakamaaga na, the earliest I can sleep now is 1 a.m. And there are days that I would just go on the sleepless nights and sleepy days, meaning I was not able to sleep at all. Like last night I slept at 3. And I was supposed to go to bed early because my body's tired. I put down my phone, my mind's still awake. The most horrendous was I slept at 8 o'clock in the morning. Can you just imagine?
Yeah, that's terrible. That's so terrible.
That's horrible.
Yeah,
You
horrible.
can imagine. Sometimes I would tell my best friend, nag-iinarte lang ba ako? Am I just acting up? Sabi niya, no. Because many times I see you dazed. That's another thing. Sometimes I'm dazed. Alam mo yung tulala? That's why I have to help myself. I mean, I always have the conscious effort to help myself. I cannot be cowed by this experience. I have to defy. But I know it's a process.
Correct. So I think,
So I take down notes.
yeah.
My favorite word is subversive. Now I have a notebook where I write it down. I have it subversive, paradisiacal, and all my favorite words when I write my column, isinusulat ko na siya. Kasi nalilimutan ko siya. It's distressing, doctors. It has affected my mental state already. So I cry many times, especially when I didn't have yet my sense of smell. Because it was not a normal life. You don't smell anything for 3 months. Tapos ngayon, maamoy mo mabaho. Classic example, I rode my car. All of a sudden, I just smelled milk na panis. Why? And then my brother said, kasi yung, di ba, sumakay dito yung friends mo the other day or a week ago, and baka natuluan ng Starbucks. Pero pinalinis ko na to eh. But even that I could smell. That phantom smell. That weird sense of smell. Na, minsan, gulat na lang ako. Can't you just imagine? Can't you just imagine niya? Minsan magtiis ka na lang. Kahit malayo pa yung tao, kung may body odor, I can smell.
Wow, okay. Okay, Boom, on that note, okay, we are going to have more time for you to talk to our guest doctors. Because I think you've touched on so many interesting points, phantom smell, your inability to remember things, and this feeling of distress and anxiety.
And my coughing.
Yeah, coughing pa, okay. So what we're going to do right now is we're going to introduce our specialists, and I'm going to pass it on to you, Raymond. But Boom, don't go away, because you are going to be part of our discussion with our doctors. Okay, Raymond, over to you.
I close my video.
Yes, Sir Boom. Thank you. We'll call you back again during when everyone is available na po for the Q&A session later on, sir. Okay. So for our first of 2 speakers from the Philippine General Hospital, you already know her because she's a familiar face, one of your favorites. Opo. And she is the head of the Hospital Infection Control Unit of the Philippine General Hospital. Please welcome again to your screens, Dr. Nina Berba.
Nina, welcome.
Hello, everybody. Hello, Sir Boom. Good morning po, everyone. So thank you again for inviting me here. I'll give a few slides before medyo parang na-interrupt natin si Sir Boom, pero we'll go back to him. Let me just, yan. So this is about evolving knowledge about long COVID. So this is the outline of my talk. I'll be really sharing some of the cases na nakita ko about long COVID that has become imprinted in my brain. Kasi parang nagulat ako na ganun pala yung impact ng COVID sa kanila. And then I'll go over, the rest of my talk will be about definitions, risk factors, why does it happen, and how can we help them. So the first case that I'll describe to you is about a doctor. But he happened to be also a mountaineer. So talagang napuntahan na niya yung Mount Pulag, Mount Apo, all the mountains here in the Philippines. And also a very intense biker. Had moderate COVID around September of last year. So this was the Delta surge. No? He's a 60-year-old male. Tapos talagang very physically active siya. Lahat ng parang activities. Ando siya. He's also a diver pala. So 6 months later, he's still unable to bike. And he says he's short of breath just after one flight of stairs. So now he needs to ride the elevator all the time. But he can still make rounds in the hospital. So because of all of this, he has actually given up on the lifelong dream to reach the Himalayan peak. Actually, a few months back, before the COVID-19 erupted, he and his wife were already undergoing some kind of training to reach the Himalayan peak. Imagine he had to give it up right now kasi parang no way, no? So the next case that I saw is a teacher. She had mild COVID-19 in February of this year. So she's a 45-year-old female. She very similar to what Sir Bumis was describing. She feels very uncomfortable about doing live lectures face-to-face with her students now with this new semester. She's always groping for words. Parang she's uncomfortable standing up in front of the students because she can't seem to find the right words and can't seem to remember any of the technical terms. No? So parang nahirapan siya talaga at this time. The third case is a nurse. She had severe COVID-19. This was circa August 2020. No? She's only 30 years old. And at the time she had COVID 2 years ago, 2 years na, no? She was on high flow oxygen for 3 weeks. It took her a long time. It took us a long time for her to get better. But she was actually discharged to home after 4 weeks. But she had to be on leave for 6 months because of feelings of fatigue, extreme tiredness. Even sabi niya, kahit po kakagising ko lang sa umaga, parang pagod na ako. Tapos medyo guilty kami dyan kasi initially we didn't know better and we thought, or I thought, ako pa nga yun that she was malingering. So parang, tagal naman ng 6 months na leave. But later on, we began to understand her. And up to today, even as she is able to report to work, she would really still complain of fatigue. And the last case is just a 20-year-old female. She's a new graduate, excited magtrabaho. She graduated with honors. And she decided to go to research. So the first step is to get employed as a research assistant. And because she was very interested in marine biology, her task in that kind of project was to collect corals under the ocean. So diver siya. She's a certified advanced diver. But like 2 weeks before the start of the project, she had mild COVID in January of this year. So Omicron surge yun. And after a week of the of her acute COVID, she recovered uneventfully. Pero she was required by the team to have a pulmonary function test. Kasi nga, divers sila. They were going to do a lot of deep dives. So she had the pulmonary function test. And unfortunately, she showed restrictive pattern in the PFTs. So parang for a while, she wasn't allowed to proceed with diving in that project and had to postpone many of the activities. So those are 4 cases of long COVID that I personally saw and tried to help along the way. But let me just go over some of the more technical aspects of long COVID now. So this is a very, very new syndrome and was only defined very clearly. The first clinical definition by the World Health Organization was just released end of last year, so October of 2021. And technically, the definition should have had been confirmed or at least probable having had COVID-19 infection. So that means the symptoms went beyond 3 months from the onset of the COVID-19, and the symptoms lasted for at least 2 months. And unexplained cannot be explained by any other alternative diagnosis. And the most common of these symptoms are fatigue, shortness of breath, and cognitive dysfunction. It comes with various names. So pwedeng sabihin long COVID, di ba? Very loosely, people would say, long COVID ka na pagka at least 4 weeks. So parang 4 weeks, 1 month ka na since the time of diagnosis. You still have some symptoms. You're loosely labeled as long COVID. No? Pero as WHO would say, dapat parang nakalipas yung 3 months. Yun yung parang hard technical definition that we use when we do research. It could also be called post-COVID conditions or long-haul COVID. You hear that also frequently. And more recently, they've been saying the acronym PASC or post-acute sequelae of COVID-19. So what are the most common symptoms of long COVID? So as I said, number 1, fatigue. Parang pagod panay. No? Number 2 is shortness of breath or trouble breathing, and Jubert will talk about this a little more. And number 3 is cognitive dysfunction, very similar to what Sir Boom said, was describing earlier, a lot of brain fog, having trouble with attention, concentration, recall or memory, trouble sleeping, or trouble with executive functioning. So boss ka, no? Pero hindi mo na maalala yung staff mo, yun. Parang ganun yung cognitive dysfunction. And there's more to that. And in fact, I listed here some of the more common. Dati parang inisip ko, hindi na yan COVID. Pero actually, now that we have been reading more and more data about it, beyond the usual fatigue, shortness of breath, and brain fog, there's also chest pain, fast beating, parang pounding of the heart, mood changes, parang 1 second happy ka, next second you're depressed. Sir Boom talked about changes in sense of smell, but pwede ring sense of taste. Fever, nausea, diarrhea, feeling dizzy or lightheaded. Towards the end of this list, yung changes in menstrual cycle, rashes, and actually hair loss. No, parang kakaiba, but hair loss could be one of those symptoms of long COVID. So scientists have tried to investigate why does long COVID occur. And one of the really very elegant studies on this was the experiment of Klein et al. They had a very complex methodology, which is shown at the right side of this infographic, telling us that they tried to identify the different cytokines and different kinds of immunoprofiling of patients who they determined to have long COVID compared to healthy controls. The HC here is healthy controls. And what they showed was, this is part of their publication, that it does seem like there were more persons who were older who had long COVID. So yung LC sa taas, that's the long COVID, and the CC sa ilalim, yun yung convalescent COVID. Nagka-COVID pero walang long COVID. So, but then again, they're showing na kahit yung mga bata less than 32 could also have long COVID. In terms of severity, there were more of the hospitalized or more severe COVID among the long COVID. But then again, they're also showing that there were also a lot of mild COVID patients, no? Patients who had just mild COVID, but nevertheless ended with long COVID. Here naman is a parang graphical representation of how much of these complaints happened. So the red bars here, which are more or less predominant, had to do with like neurologic related complaints. No? So brain fog, you see here headache, difficulty in memory, dizziness, difficulty sleeping, all the way to the left side, yung mga altered taste and tinnitus. Pero there's also a lot of color green, which is pulmonary symptoms. And the highest, of course, is yung light blue. The highest bar is light blue, almost like close to 90% of all of those who had COVID complained of fatigue. No, constitutional symptoms ang ibig sabihin, complained of fatigue. The next picture I will show you is like really busy, but this is the heat map. So self-reported complaints were like logged into a dashboard and how often they were reported. And again, you would see na parang ang daming red, which are the neurologic. The light blue occupies a really long horizontal spanning of the dashboard, which is the fatigue. So parang ganyan yung itsura niya. So there are a lot of complaints, and most of them would again be number 1, fatigue, number 2, shortness of breath, and number 3 would be brain fog. The Gavi website will tell us that when you put this all together, it would sound like there's about anywhere from 1% to 5% cases of long COVID after the acute COVID-19. And most of this could be linked to, number 1, advanced age, number 2, obesity, number 3, asthma, number 4, female sex, and number 5, prior physical and mental health. So why does this happen? Bakit merong mga hindi masyadong maswerte na after an acute COVID, they will get into this chronic condition? So it looks like they have higher levels of cytokine biomarkers, and that's what we saw in the first study. That means parang there's this persistent immune activation caused by the SARS-CoV-2. And they saw that in this study of Peluso, parang when they measured these cytokines, they were higher. So lalo na yung interferon, interleukin 6, interleukin 10 yan, and tumor necrosis factor. So all of these are like inflammatory markers which sort of tell us na the inflammatory response, which we do know that the SARS-CoV-2 trigger doesn't end after the period of recovery. But for these patients, parang here, okay, how do we read this? So these are multiple graphs from that study telling us that yung merong long COVID, that's the PASC, no, post-acute syndrome of COVID-19, they're always a little bit higher than those who didn't have long COVID, whether it's interleukin 6, interleukin 10, tumor necrosis factor, and the different antibody responses. No? So mas mataas, parang chronically, meron kang some amount of inflammation. Tapos, people also wanted to see just how heavy is this burden. No? So this group of Groff et al. Put together different studies in a systematic review. And they said that, so medyo busy again yung slide na to, pero what it's trying to say is the burden or the incidence rate of long COVID will really depend on how long they did the study. So may mga studies na 50 days lang or 100 days lang. Syempre, madami pa doon, may long COVID. But when some studies took as long as 200 days, close to a year, they would see na medyo parang nag-iiba. But look at the way the dots here in different countries have been shown here, have been documenting the long COVID incidents in their countries. So India may be as very close to 100%, and in the US, very, very close to 75%. So it's not as infrequent as we think it was. No, na many of the symptoms we think are not related to COVID may actually fall under long COVID. So for example, in their meta-analysis, they showed na it could be as heavy, the burden of illness could be as heavy as close to 30%, yung mga neurologic disorders. The cognitive dysfunction here on the left side of the graph tells us it could be as somewhere between 18% to 30%. And the mental health disorders it causes, no, yung depression, anxiety, and even a post-traumatic stress disorder, falling into that category may be as high as 20% among those with long COVID. Tapos ito naman yung respiratory disorders, and Jubert will talk about this a little bit more. And the mobility impairment, yun nga yung parang merong some amount of functional impairment. Look here, it's as much as 50 to 60%. No? So hindi siya minor, and it's something serious enough for us to be aware of, recognize, and try to help our patients with. No? There's a comment kanina, nag-lose siya ng maraming weight. Na weight loss is part of it. A lot of muscle pains, yan. And of course, fatigue is always there. Okay, so what can we do? No? So many of us in this audience may fall under healthcare providers, and we need to recognize that we are among the most trusted advisors and influencers of health decisions of many people, no? Patients, friends, family members, staff, colleagues, yan. So when somebody comes to us and trying to describe something that sounds like COVID-19 or long haul or long COVID, what can we do, no? So we can talk to them this, syempre yung unang discussion, them telling you ano yung nararamdaman nila. So try to like talk about the overall impact that these symptoms are doing to their lives. And that parang siguro, depending on the symptoms, some of them could be addressed by self-help, yung nagbabasa, tapos tinutulungan mo sarili mo. But some of them may actually need additional referral from other specialties. And then talk about what it will be for the future, no? So how these symptoms may actually fluctuate and recur. And it's important for us to really help support them and not try to make them feel na yun, or guilty ako, nagmamalinger ba ako, or naloloka na ba ako, yun parang ganun. And they might really need help in various times of trying to cope with this. So after a holistic assessment, talk about it. It needs to be like a shared decision. Hindi lang ikaw yung sinasabihan mo siya, pero nag-uusap kayo kung ano yung parang best for that person. It doesn't have to be a patient. Pwedeng friend, pwedeng anak mo, pwedeng parent mo, pwedeng relatives, and others. And advice on self-management, I think mahalaga yan, yung anong pwede niyang gawin. And then, suggest referrals depending on what you think he needs, whether psychiatric, neurologic, or pulmonary, rehab, etc. And do not forget these essential aspects na baka naman hindi rin long COVID. Baka there's another entity that you can diagnose, kasi baka naman hindi siya long COVID, baka totoong dementia siya, or baka depression talaga siya, or something like that, no? So just make sure that whatever is possibly corrective that you are able to correct. and especially try to address yung quote-unquote stigma. So many of the patients with long haul COVID, just like our patient number 3, si nurse, di ba parang nag-guilty nga ako kasi parang na-mislabel ko siya as malingering. So sana we don't get into that. And we try to really understand. But this long COVID persons or patients, they really undergo a lot of mental health problems kasi nga they're labeled many ways from psychiatric disorder to malingering, yung ganon. So let us help them cope with that also. So yun. Finally, my take also, being an infectious disease doctor, ano pa yung pwede gawin? So there's data showing that being vaccinated seems to also reduce the risk for long COVID. So these are modeling probabilities showing that after receiving mRNA or the adenovirus vector vaccines, there's like a decline in the risk for long COVID. So yung mga unvaccinated pa sa ating mga kapaligiran, try to make them understand na kasi ngayon parang people say, okay lang magka-COVID kasi sandali lang naman yun eh. But that's not always true. And for me, kasi ako, I don't think I'm at risk for severe or critical COVID now that I'm vaccinated, but I really fear getting long COVID and getting brain fog, especially after talking with many patients na may brain fog. I don't want to have long COVID. So try to always, at the end of your discussion, always offer COVID-19 vaccination. Tapos make it easier. Try to find a way if you're in a hospital setting or if you're in a school setting to have parang operationally make it easier for people to get vaccinated, whether primary series pa or booster. Tsaka may mga tao, delayed talaga yung decision making nila. Like last week, I met a patient na sabi niya, Dok, pwede ba ako magpabakuna? Tapos nagulat ako, sabi ko, what do you mean, pwede ka ba magpabakuna? Hindi ka pa ba ever nagpabakuna? So sabi niya, Dok, hindi, kasi hinihintay ko yung go signal mo. So parang nagulat ako na meron pang subpopulations amidst us na gano'n. And instead of like, maybe underestimating them, try to like really be encouraging. Oh yes, pabakuna. I'll write a certificate for you kung kailangan yan, whether primary series or booster. Finally, my last message on long COVID. I think we should really give hope for all of this long COVID quote-unquote victims. Parang victims sila, no? Say do not despair kasi there is really hope. Many of the patients actually in time recover. So, but in the meantime, talk about coping, like mental health kind of coping, and offer solutions. Yun. That's it na. Thank you very much for your attention. If you have any questions, just email me through this email address. Thank you.
Ako, thank you very much, Nina, as usual. No, nothing short of what we expected. Puro heart, puro ganon. Very short, but very and very clear. And we're looking forward, Nina, to our conversation with Büm, who might have some more questions for you. No? So maraming salamat, and you see the appreciation of our audience in the chat box. Okay, so as we said, we bring you the best speakers. So you have Mr. Büm Tenorio, you have Nina, and of course, we wouldn't do this session without having a clinician who's been handling more of the serious cases of COVID at the Philippine General Hospital. Although, as Nina said, no, it's not necessarily, you don't necessarily have to have serious COVID to severe COVID to get long COVID. But anyway, we're going to hear a little bit more about respiratory sequelae and side effects of long COVID from the head of the CCU, Management Action Team or the Critical Care Unit at the Philippine General Hospital. One of your favorites and our favorite, Dr. Jubert Benedicto. Jubert, welcome to the webinar.
Hello, good afternoon everyone, and thank you once again for the invitation.
Oo.
So,
Sige, Jubert, what's your take on this? Kasi we wanted Jubert to, not to prepare
yes,
a presentation, but to give his thoughts and his insights, having managed all of these serious COVID patients. Go ahead, Jubert.
yes. Yeah. So definitely siguro yung unang message ko hindi kathang isip yung long COVID or post-COVID condition as what Nina pointed out. I'm also guilty, just like Nina. Siguro marami kaming nakikitang mga individuals who had COVID. Tapos nung 2020, 2021, we were convincing them, tapos na nga yung recovery period mo eh. Tapos na yung 14 days. So magaling ka na. Pwede na kitang bigyan ng clearance for work. Kung hindi ka bumalik sa trabaho, parang nasa iyo na yon. Pero ako as a doctor, pwede na kitang bigyan ng clearance for work. And I feel we had some shortcomings way back then because we, as what Nina pointed out, ang dami naming hindi alam as far as post-COVID condition is concerned. I've been using the term post-COVID condition kasi I was corrected by one of my colleagues na sabi niya yung post-COVID condition, yan yung ICD-10 na official term. So as what Nina pointed out, yun din siguro ang shortcoming ng literature ngayon, ng scientific community, in that in terms of definition, we have been using at what she mentioned, long COVID, post-COVID condition, post-acute sequelae of COVID-19. Pero sabi nga raw nila sa ICD-10, it's post-COVID condition and it is traditionally defined as 30 days after your deemed recovery, you still have this nagging persistent symptoms. As what Nina pointed out, ang shortcoming kasi ng literature, we don't have a standardized way of diagnosing it. We don't have a standardized set of definition to fulfill automatically for us to possibly label an individual really as a post-COVID condition. Pero madalas, at least sa ICD-10, it's 30 days from deemed recovery. But as what Nina pointed out, sa literature, lalo sa WHO definition, 3 months yung madalas na ginagamit na cutoff. Why that cutoff? Well, specifically because as what was mentioned, di ba? Remember sa start ng COVID, we have been looking at kailan ba hindi viable yung virus na yan, and it was shown after 14 to 21 days, hindi na siya viable, hindi mo na siya makukulture, and therefore, as what was mentioned, yun yung naging aming timelines for recovery. And therefore, we traditionally say, pag nawala na yung virus, post-COVID condition na yan. That's why that timelines, no? But having said that, I fully agree with Nina. We do know so little as far as post-COVID condition or long COVID is concerned. Yan lang madalas ang sasabihin sa atin. She mentioned the risk factors. I would like to add, syempre, yun yung may mga diseases or comorbidities. They have shown in some studies, diabetics, the hypertensive, especially if uncontrolled, are more at risk of developing post-COVID condition. Even smokers, no? Post-COVID conditions as well. She mentioned as well yung mga at least theories, it's secondary to the virus kahit wala na yung virus. The fact that the virus perturb your immune and inflammatory response means, as what she mentioned, yung inflammatory markers mo, medyo mataas pa rin. And that's, in a way, is the one creating havoc, no, sa various system ng body. They tell you as well, COVID tends to unmask certain things. I'm a pulmonologist, and majority of the time, because it is fatigue, it is difficulty of breathing, it is dyspnea and exertion that may drive the individual to consult us. Post-COVID, yun yung mga common symptoms na nakikita namin, and of course, bothersome cough. We frequently will subject you to a battery of tests, especially coming from a pulmonologist. So ano pong ginagawa namin? Pinapa-x-ray namin kayo, kung hindi CT scan. Why? principally because we believe that ang mga post-COVID changes sa lungs, they tell you that 50% of them really gets resolved within 3 months from the time of your recovery. 80% of them gets resolved within 9 months to a year from the time of recovery. So if we see something in your chest imaging, we are thinking along the lines na, baka post-COVID condition na to, or maybe COVID unmasked certain things. Nagkaroon ako ng patient when I saw the CT scan, nakita ko bronchiectasis, no, or some changes in the peripheral or small airway. Irregular na siya, baku-baku na siya, hindi na siya ganun ka-smooth. And therefore, these patients have a tendency to accumulate phlegm. Tapos ang bothersome sa kanila, ubo po ako ng ubo, parating may plema. Pinaculture ko yon, non-tuberculosis mycobacteria. So parang na-unmask ng COVID in a way, no? So I'm not saying it might be secondarily to COVID, but because of that battery of tests, I was able to treat an underlying condition, maybe predisposes that particular individual to chronic symptoms. Pero at least na-address namin yon. Ano pang pinapagawa namin sa inyo? Usually, you will undergo what we term as cardiopulmonary exercise test, especially if dyspneic ka, which means the patient is being hooked to a bike. Magbabike siya madalas, tapos para siyang may mask. We tend to measure gas exchange, and then we frequently will have that conclusion or assessment, yung difficulty of breathing mo may be secondary to deconditioning or cardiac condition or pulmonary condition. We do spirometry on you, yung parang huminga ka malalim, tapos bubuga ka, and then we measure certain things. Why? Again, principally because even if, let's say, post-COVID condition, they have shown that, let's say, in around 30 to 50% of the time, there is some reduction in your FEV1 or your pulmonary function test. And therefore, that individual may be prone to develop some exertional dyspnea as well. Ang good news doon, pwede ka naming mabigyan ng bronchodilator or a short course inhaled corticosteroid to possibly alleviate your symptoms. So my point is, we tend to do certain tests, especially based on your symptoms, because we are trying to see if we can reverse certain things. If, let's say, your COVID condition unmasks certain things, but then again, baka pwede namin yung i-address. Baka nagkaroon ka ng reflux that can account for your chronic cough or what I mentioned, bronchiectasis. And therefore, our treatment will be more targeted. We do know that in 24% of the time, based on epidemiologic studies, certain chest imaging will tell you na may nagpe-persist na finding. So ito yung fibrosis. Ito yung sinasabi nilang some form pa rin of inflammation, etc. When those things happen, we frequently will possibly give you a trial of certain treatments already. Yung fibrosis, meron tayong anti-fibrotic agent na available naman sa Philippines. So I'm talking about nintedanib or pirfenidone. Pero syempre may side effect din yan. So we're trying to weigh things to tell you, mukhang ito yung pwede naming ibigay sa inyo, etc. Nina pointed out yung rehab. Yes, we don't underestimate the value of rehab, especially in post-COVID condition. Ang learning ko po siguro out of seeing these particular individuals who were afflicted with COVID, and we are more than 2 years into the pandemic, sabi ko nga sa mga patients ko, we learned COVID made us celebrate and thank God for small blessings. So I had a patient, sisiw sa kanya tumakbo ng marathon. Tapos galit na galit siya kasi post-COVID, Doc, hirap na hirap ako kahit 10K. Dati sisiw na sisiw yung 42K eh. Ngayon hirap na hirap ako, 10K. Talagang minsan lakad po, pinipilit ko pa yung sarili ko. So sabi ko sa kanya, ang good news sa'yo, nagka-COVID ka, nakasampa ka ng 5K. Ako nga, hindi pa ako nakaka-5K na dire-diretso na hindi hinihingal eh. No? So I'm not, dampening or tinitake for granted yung symptom niya. What I'm trying to say is maybe we can focus on the positive things rather dun sa mga hindi mo nagawa, yung nagagawa mo ngayon. So I was telling that particular individual, alam mo, nung nakita kita sa lung center, naka-high flow nasal cannula ka. Hirap na hirap ka huminga. Ngayon nakakatakbo ka na ng 5K. And then we are aiming for, of course, your usual 42K. It's really, as what Nina mentioned, dapat maging supportive tayo. It's a long haul thing again, hindi siya magic solution. Sabi nga nila, we should focus more on healing rather than giving multiple treatment to such individuals. So I would tend to tell my patients, ano na po ang kaya niyong gawin? Saan po ba tayo nanggaling? Eh di po ba mas magandang kaya na natin to? At this particular point in time in your journey, ang pinaka dapat mong hindi ginagawa, number one, you compare yourself or your pace with others. We all heal at our particular time. Pero yung secret lang siguro sa mga healers, they tend to persist. They tend to be, masigabo, masikap sila sa healing nila, hindi sila sumusuko. So madalas yan ang sinasabi ko sa patients ko. No? So pagtiyagaan natin, unti-untiin natin, then let's celebrate your milestone. So balik siya sa akin, Doc, sisiw na yung 10K. Pero na-frustrate ako, hindi ko na-hit yung aking usual personal record pag 10K. At sabi ko, simulan natin ulit. No, you have to learn it again kung paano mo nagagawa yon. So wala po siyang magic solution itong long COVID. As what Nina pointed out, a lot of things we still do not know. But tama si Nina, it's a real entity. They need support at this particular point in time. Yes, we tend to do multiple tests, hindi dahil sa hindi kami naniniwala sa inyo, pero we are trying to see if we can unmask certain things that maybe we can offer specific treatment to. And then magkaiba po kasi yung yung implication. So for example, may asthma ka, nagkaroon ka ng COVID. Tapos hirap ka ngayon huminga. The doctor will tend to do some tests on you. Kasi pag nakita niya yung asthma mo naman ay well-controlled na ngayon, then maybe it's really the COVID, the fibrosis, the inflammation it created. Those are the ones which are bothersome to you right now. So it's not a matter of just escalating your anti-asthma medication. So yun po yung gusto namin gawin. Siguro in conclusion, what I feel is that post-COVID condition is here to stay, and possibly as clinician, isa po talaga yung sa dapat naming mga differential. As what Nina pointed out, marami pong post-COVID condition manifestation, neuropsychiatric, pulmonary, cardio, cardiology, ang dami niyang manifestation. So maybe isa talaga sa differential diagnosis ng clinician, nagka-COVID po ba kayo? Gaano po kalala nung may COVID kayo? And then the possibility of looking at maybe you are dealing with a post-COVID condition. Unfortunately, not all centers have a long COVID clinic, which I think we should have. During the 2021, early part ng 2021 sa US, when you listen to CNN, ang post-COVID condition clinic nila, 3 months in waiting. So they get a lot of patients, 3 months. I know some centers, like for example, Lung Center is trying to do it. Meron po kaming standardized way of approaching a patient once we see na post-COVID condition siya. And then the way we follow up and we structure a specific rehab program geared towards your need. So, yun lang po siguro ang ko-comment ko. And again, thank you very much for the invitation.
Thank you very much, Dr. Jubert. Nako, ayun na naman, palakpakan. At ito na naman yung nakasulat sa chat. Thank you so much, Jubert. That is very inspiring. I think people were picking up a lot on focusing on the healing and being positive. And I think, I really resonated with what you said about having long COVID clinics and being more programmatic about this, no? Kasi otherwise the level of frustration of the patients really goes up a lot, no? So I think this has really been very good. So we are going to have a conversation between our two experts and our patient. But before that, Raymond is going to give us some reminders. Raymond, go.
Thank you, Dr. Susie, and thank you also. Marami pong mga comments with regards to healing in the chat, Dr. Jubert, if you can take the time to see them. But before we proceed with our discussion, we'd like to take this opportunity to have a very short public service announcement for today.
O sige na, anak. Parang kagat lang ng langgam. Kantik o yung kumikiliti lang. Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ko rin po ang color nito. Pero ayoko po ng red huntik. Masakit kumagat at takot rin po ako sa blood. Magtutugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O, heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love. Thank you, Doc. Thank you, Nay. Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communications Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 to 18. We hope you can share this message and this video clip in all of your social media. Stay safe and stay well. Magpasama na po sa Bakuna Center. We also understand that each of you really have very fast-paced schedules. You're very busy individuals. So what we came up with is what we lovingly call the SCD Shorts, so that you can watch them at your convenience in the TVUP YouTube channel. So you just type in youtube.com/TVUPPH for you to be able to consume or watch po ang aming mga very short videos for nuggets of wisdom. And we will now start the ball rolling for our panel discussion. Dr. Susie?
Thank you very much. So we've got Büm, we have Nina, and we've got Jubert all on the panel. And we're going to have a conversation around long COVID. But just to get the ball rolling, let me ask a question first that I think could help us sort of frame what the issue is now. I think for Büm, it seems na yung question na nag-iinarte lang ba ako? Am I just imagining this, right? Is this real? Or, am I overdoing it? Or do I lack willpower kind of thing? No? I think both Nina and Jubert have addressed this and said, no, this is the real deal, right?
It's the real thing.
It's a serious thing. And actually, I was just reading something that said there are over 200 kinds of symptoms of long COVID or post-COVID. What did you call it? Post-COVID condition, not PCC, post-COVID condition. Okay, so let me start with Büm, no, because I think it's in this webinar we like to talk a lot about sort of like the more subjective aspects of COVID, and you felt that you were doubting yourself. Okay? You were saying, nag-iinarte lang ba ako? But you had people who noticed that there was something different. Would you like to talk about that a little bit?
I think
What
it's
was your
pride.
experience about people saying na parang, teka muna, parang, meron kami din napapansin sa'yo. Go ahead.
I think it's pride. I don't like to admit siguro in the beginning that I really am suffering from long COVID. So that's why it's a defense mechanism. Baka nag-iinarte lang ako. It's not true because maybe quickly I would be able to pick up myself because I catch myself all the time.
Yeah.
And I train myself not to I train myself to remember things no matter how arduous, long the process may be. I have to remember the name of Andre Caballero, even if it took me 13 hours. I always have notebook with me, a pen. I remember. I have become more a voracious reader now. I read. Kahit minsan, I know na yung 99% accuracy ko ng retention ng binasa ko, kahit balikan ko palit yung chapter 2 ng binigay na libro sa akin ni Lucy Torres Gomez, balikan ko siya. Oh, this is what it's saying. So, mga ganyan. What I'm trying to say is quantifiable yung diminished sa akin. Kaya sinabi ko na sarili ko, I accepted it na. This is not about acting up anymore. This is not pag-inarte anymore. More especially, I heard it from Dr. Berba and Dr. Benedicto na it's real. So, what I have to do now is to be more conscious when it's happening. Now I'm thinking of the perfect word to say.
Go ahead. Take your time. Take your time, Boom. It's fine.
Yung sa akin kasi, because I love to talk and I write, it's pronounced. Because it's my job to give words. It's my job to also when I verbalize my thoughts. So more pronounced sa akin. Kaya nalalaman ko na, I'm groping again. I forgot the word. I don't know what to say. Yung mga ganyan, yung alam mo yung gano'n na alam mo, ayan, nawala yung word. Yung gano'n.
Yeah. Nina or Jubert, I mean, what's the role of the family or other people who kind of may notice, kasi it becomes the burden of the individual, no, na parang there's something wrong with me, but maybe not, right? But in your dealings with families of individuals with long COVID, what's the role of the family here? Nina or Jubert? Either.
Ina muna.
Oh, Nina, ikaw muna. May role ba yung family? Yun ang tanong muna. May role ba?
Oo, kasi yung family, sila talaga yung first na makaka-recognize that recovery is not complete. May kulang. Hindi pa siya balik sa normal, di ba? So, yun, initially, the family should also try to recognize that there's a long COVID phenomenon and initially try to assess kung kaya na at their level na with support, matutulungan na si mama, si papa, or whoever in the family has it. Tapos sila rin yung mag-i-initiate nung step towards seeking professional help kung kailangan ng, additional supportive measures in terms of, let's say, rehab or diagnosis or trying to understand what's happening. Minsan kasi the patients won't go to the doctor themselves.
Yeah.
Kasi sabihin nila, ay, ayoko na pumunta sa ospital. Parang ganun.
Yeah, Jubert, how about you? What do you think,
Yeah.
family, role of the family?
Definitely, Ma'am Susie, talagang napaka-crucial ng family. I had a similar patient, Sir Boom, na ganyan, brain fog, brain fog. Na-intubate sa lung center, tapos nung na-discharge na, yun yung point niya. To be honest, nag-hop siya from one doctor to another kasi nga raw walang naniniwala sa kanya. Ang bothersome sa kanya, yung brain fog. Teacher siya. Tapos nababa na siya dun sa husband niya kasi the husband was trying to finish her sentences. So nag-grope siya ng word, yung husband yung nagsasalita.
Right.
Para sa kanya, nadidiminish mo lalo ko. Kasi parang tinatry ko ngang on my own eh. Ganun kasi yung personality ng teacher niya, yung patient. No, she was trying to do it on her own. Ang point niya sa husband, maging pasensyoso ka lang. Please be patient with me na bayaan mo kung matapos yung sentences ko and everything. So there came a point na umiinit na yung ulo niya kasi pati yung mga anak niya nakikiloko na rin eh, no? Yung mama ano yan? 4 words? 4 words? No? So parang nakikigame na sila. Pero yung mga anak kasi, sabi ko nga, wag ka na magalit dun sa mga anak mo kasi ang anak mga elementary school eh, no? So sabi ko baka sa kanila iba naman yung way ng pag-cope nila dahil nakikita nila yung mother nilang ganon. Tapos the fact na alam nilang nanggaling yung mother nila being intubated, nasa ICU, akala nila hindi nila makikita. So parang the fact na nakikigame sila sa'yo, para sa mga anak mo, celebration of life yun kasi nandyan si mama. So yung husband more ma'am ang nasabihan ko. Kung gusto ng wife mo to finish it on her own, wala kang magagawa, just be patient with her. Kasi yung personality ng wife mo, she wants to do it on her own eh. When she's ready, when she asks for your help, oh, tulungan mo naman ako kasi hindi ako makatulog unless na masabi ko, makuha ko yung tamang word. Then that's the time you possibly sabihin mo na yung suggestion mo. So I think Sir Boom, tama ka dun eh. Yung coping mechanism natin, may kanya-kanya tayo. Sabi ko nga, may kanya-kanya tayong pace of doing certain things. I like what you did, Sir Boom. Nasabi mo nga, you were humble enough to admit, oy, kailangan ko ng notebook, kailangan kong isulat or what. So tama po yun, sir. You are on the right path.
Thank you.
Yeah, very good. Yeah. Boom. You have questions for Nina and Nina and Jubert. Any questions you have for them?
Yeah, I would like to understand my case all the more. First, is there such thing as degrees in long COVID? Am I mild? Is this simple long COVID? Or is this what do you call it? What mild and I don't even know the antonym of mild. Can you just imagine? Severe. Severe. Oh, am I mild, severe, or what? Severe yata ako.
Sige, si Nina muna ulit.
Because,
parang walang categorization kasi it's so variable. The variation as we saw, talagang like more than 200 symptoms. Initially nga, I thought some of the symptoms weren't even related to COVID-19, but they've been seeing. So, pero kasi even the impact of a certain symptom might really be quoted as mild for some persons, third person, diba? Third person seeing you, ano ba naman yung diarrhea, parang ganun, or ano ba naman yung hair loss, but for you, the impact of that might be very, very serious. So parang walang ganun, walang agreed upon categorization or classification of the long COVID. This is also kasi happening now, diba?
Yeah.
It's in evolution, so I guess people are still also groping with how to standardize definitions.
I have a follow-up question to Dr. Berba and
Dr. Jubert.
And Dr. Jubert. Dr. Berba, when I interviewed you for my column, you said it right away in my text. Oh, that's brain fog. That's long haul COVID. But don't worry, it will go away. My question is, when will my brain fog go away?
So yun, walang tamang sagot doon, tsaka walang definite na sagot doon. But many of the people I know who have had long COVID, or we described as long COVID nung unang panahon, nung original Wuhan virus pa yung ating kalaban, they're doing very well now. They've overcome, whether it's because natapos na yung inflammatory response or they've responded to the rehab that they underwent. So I feel certain that most people with would get over the manifestations of long COVID. Kaya lang talagang parang crystal na bola, walang may alam or can't define yet or predict how long it's going to last on a per individual basis. Unless Jubert has more information.
Hindi, Sir, Sir Boom. We can just quote statistics, unfortunately. No, so as what Nina pointed out, if we're focusing on brain fog alone, my neurologist friend will always tell me, hindi, usually pag brain fog, yan yung lingering compared, let's say, daw dun sa nakikita ko na mga chronic cough or something. So they just quote, sir. So majority of the time, they tell you that brain fog will go away. Wide po yung range 1 to 3 years. But they tell you as well that certain, things may help you in terms of possibly hastening po yung recovery. What
Like
you're
what?
doing is actually correct. Yung parang china-challenge nyo yung memory nyo. Diba? China-challenge nyo. May patient po ako na, syempre hindi ko naman siya kaagad pinag-crossword. Alam niyo yung nilalarong 4 picks 1 word?
Yeah.
Yung sa phone, 4 picks 1 word. So yun lang muna. Sabi ko nga, simple things. 4 picks 1 word siya. Tapos meron pa akong patient na word hunt lang ang ginagawa niya, word hunt. So ang point lang po doon is that, as what Nina pointed out, yes, it's generally attributable to chronic inflammation and it tends to go away. So ang ginagawa lang po natin is trying to what we term as parang nire-retrain po natin yung brain ninyo na magawa niya yung dati yung nagagawa. So sabi ko nga, para kang bata na magsa-start ka ulit na, magko-compose ulit ako ng sentence. Maybe hindi ako ganun kabilis mag-compose ng sentence na magaganda tulad nung kaya kong gawin. But you have to start somewhere. Tapos ang advice ko lang, Sir Boom, huwag ka ma-frustrate. It's really frustrating. I can empathize with you. It's quite frustrating. Pero yung point ko nga, each time ma-frustrate ka, isipin mo na lang, dati nga, ganito ako Ito ngayon, nagagawa ko na. So, and keep at it. Be persistent po. Huwag kayo magpatalo dyan.
Thank you very much. Isang exercise na ginagawa ko din, which I always do when I'm on the road, in the car, and then I see plate numbers. Siguro ito rin yung suggestion ko. I form words.
Wow. Okay.
Tapos I invent, kasi I'm always pregnant with ideas. So all the more now, na ginagawa ko, kunyari, nakita ko NBK, o iisip ako ng word na ganyan. Tapos yung ganung mga plate numbers, I form words and then nagagawa ko ng storya sa mga plate numbers sa kalsada. Just to train my mind. I need to help myself.
Advanced na yun.
Yeah, Dr. Jubert, I have a question.
Yes, sir.
Though this has been answered or explained to me by Dr. John D. Buensalido,
okay,
who first told me about, who really explained to me what long COVID is all about, yung pinagdadaanan ko. And it was also explained to me by my pulmonologist, Dr. Obilio. What is happening in my lungs? Why my respiratory? Why is it that every 2 months or 3 months, I would develop a cough? One cough will be different from the other. Itong a month and a week ago, yun yung pinakamalala because I had early stage pneumonia complicated by asthma. Take note, yung asthma ko, nahuli ko nakita siya nung 7 years old ako, though hindi pala siya nawawala, no? Nag-resurface. Nag-asthma na naman ako 1 month ago. I had to be tawag dito, nag-nebulize na ako. I want to understand what's happening in my respiratory tract.
Yes. First of all, yung COVID, sir, especially COVID itself, has that tendency to, as what I've mentioned, to unmask. So, ibig po sabihin, kahit po yung mga disease ninyo na well-controlled previously because of this quote-unquote chronic inflammation will possibly, at this point in time, really manifest itself. So, tandaan po natin, pag asthma, it's an inflammatory disease of the airway. So you can just imagine, pag smaller po yung airway, konting pamamagalang will have that tendency to magkaroon ka ng bronchospasm, tapos obstruction. paano pa kaya kung may long COVID ka? You have, as what Nina mentioned, may condition ka na may chronic inflammation pa rin dyan. If you are being exposed to a proper stimuli, be it stress, be it changes in weather, be it dust, the airway has the tendency to bronchospasm kasi kinokorek niya, ayaw niyang pumasok yung noxious stimuli sa kanya. And what happens? Yun na po yung nagmamanifest ngayon. So, to start off, dahil po dun sa long COVID nyo, maybe nandun po kayo sa halos suboptimal condition ng daanan ng hangin, tapos may appropriate stimuli pa, so that will compound matters. That's why napaka-mas prone nyo po sa hyperreactive airway or to possibly an asthmatic attack.
Ay, nakakabaliw to.
Thank you so much, both Jubert and Boom, for that that discussion. No? Raymond, ang daming questions sa chat box na sa Q&A na maganda. Raymond, please, let's take some questions from the audience.
Okay. This one coming in from Zeni Sardido. I chose this because I think it will be relevant, and since we're in it's a public service program, maybe we want to be able to share this. Is there a PGH program or a UP program that assists patients with long COVID symptoms, especially because we expect this disease will be going on for years? Dr. Nina, napag-usapan na ba yun? Or Dr. Jubert?
Napag-uusapan po siya ng pulmo kasi as what Nina pointed out, nung nagsimula talaga, it's really the pulmonary symptoms that were driving the patients to see the doctor. Tapos nga, ang nakikita namin is are among those who had high flow or intubated, so automatic sa pulmo sila nagpa-follow up. So we are trying to set up from the Division of Pulmonary Medicine a one-stop shop po for post-COVID condition or long COVID. So we would like na dun lang sa one-stop shop, nandun na sana may kung pwede namin i-refer, nandun na sa rehab, may psych, merong neurologist, para hindi pa balik-balik yung patient kasi ayaw namin sila ma-frustrate. And then we are envisioning, like what I've mentioned, you will undergo certain tests depending on your most bothersome symptoms in order for us to have a more tailor-fit approach for you.
So I think it's really having a team approach, no? I mean,
yes,
as in all rehab where you lose some kind of function, really the challenge is to try to recover and to manage the expectations of the patient, no? So, kailangan talaga ng team effort yun. Sige, Raymond, meron pa tayong some interesting ones there, and then we'll have to go to our fun quiz. Go ahead.
Okay, this one is, in your practice, which management seems to be effective for patients experiencing chronic fatigue and decreased exercise tolerance due to symptoms of long COVID? Sige po.
sasagutin ba ni Nina yan?
Sige.
Nina, go.
Ako
Nina,
kasi
go.
rehab ang short answer ko dyan. Nina.
Ako, ang sinasabi ko sa mga patients is really to recognize the limitation at this time and adjust the activities accordingly. So kung alam mo na nahihirapan ka umakyat ng hagdan, try to go for the elevator. Walang masama doon. If you used to run like a marathon, like just go for like a kilometer muna and then proceed from there. Kasi parang there's no point pushing yourself beyond what you can do. That leads only to anxiety and depression. So, yun nga, as Jubert was saying kanina, count the blessings, count the blessing na we survived it, andyan ka pa, tapos may hope for tomorrow. Panay, yun yung kailangan mapasok sa minds ng ating mga pasyente kasi it's very difficult to suddenly okay ka, tapos after like a week or two or maybe a month of COVID-19, biglang you can't do many things anymore. Like some of the dreams, like yung going for the Mount Everest peak, di ba? Tapos biglang wala na. You've been aiming for that for the longest time and training for it. Tapos biglang impossible dream na siya. But you know, we could still turn around whatever has happened and hope na we change enough and improve enough to get back to where we were before.
Yeah, I think Nina, it's really very important for patients to hear from doctors like you, like Jubert, that it's okay that you can't do these things right now. Diba na okay lang yan. And this is what, as I was saying, patients need to manage their expectations of themselves. Kasi throughout this pandemic, we've been thinking that this will all magically disappear. I think what we're really seeing now is that the impacts of this pandemic are far from understood. And so therefore the effects also on the individuals are, kailangan let's be kind to ourselves, no? Na okay, hindi kaya, okay lang yon. For the moment, it's fine. And we'll all be positive and hope, but it's good for the doctors to say that to the patients because you're giving the patients permission to not try too hard at a point where they can't do it, no? So I really like the way you both have been explaining it to your patients, and we hope through this webinar our frontliners who are also talking to patients have a model. Diba? This is the way to explain it. Oh, isa pa, Raymond, one more before we go to the answers to the fun quiz. And then we'll go back to Boom. I think Boom wants to say something. Go ahead,
Okay.
Raymond.
Sige. This one is, well, I think it is important. I'll just combine these two questions.
Sige, go ahead.
Long COVID cases in men who complained of, I think this is erectile dysfunction or decrease in seminal discharge, and then what do you call this? Corollary to that, long COVID causing infertility issues among childbearing couples. Has that been been
Nina.
posed to you?
Si Nina siguro yan. Nina, ano ba?
I don't know about childbearing. Parang hindi ko pa narinig yung reports about that being associated with infertility. Pero meron talagang mga complaints na sexual dysfunction. Nasa mga 15% siya. Dun sa graph na pinakita ko kanina. Andun siya sa medyo on the left side, yung lower part of it. Pero there are complaints of that. That's beginning from changes in menstrual cycles to exactly yung sexual dysfunction. Yeah, so there are, yes.
Okay. Raymond, maybe let's go. We're coming close to the top of the hour. Raymond, let's go to the answers to our quiz.
Okay, thank you so much. For these three questions, so Dr. Jubert kasi was there with us, so I will ask all three questions to Dr. Jubert na lang for the correct answer. First question, a case is considered long COVID when? Dr. Jubert?
Yung symptoms, yung pinaka-best answer dyan, yung symptom persists 30 days after deemed recovery.
Ayun, okay. Okay. So, it's not about how bothersome the symptoms are and persistent across time, and it's not about kung gaano katagal ka sa hospital.
Correct, Raymond.
Okay. Sir, as the second question reads, how is long COVID managed?
Rehab tayo, rehab. Ang pinaka-proven. Ang pinaka may role siguro, not necessarily proven.
Okay. And then our last question, true or false, only severe to critical COVID patients get long COVID?
False. Kasi sabi nga ni Nina sa kanyang examples, may mga mild siya na naglo-long COVID.
Thank you so much, and I hope our audience po were able to capture ito pong mga tamang kasagutan. We are sharing the correct answers and the results po, no? And we hope you'll be able to take note of that as part of our learnings for this webinar. We will now switch over to our panel evaluation poll, giving enough time for each of our three speakers to formulate their parting words to our audience po. So while they're doing that, I'll read the questions, and we are not sending out po a separate evaluation poll. This is it. Wala na po kaming hiwalay. So we encourage everyone to participate and put in your feedback for the evaluation of this webinar. It's a 4-point Likert scale with 5 questions. They read as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We will not be closing this evaluation poll as we move back to the final messages from our speakers.
Okay, thank you so much. I think I want to start with Boom because you opened the webinar and the audience you have right now are frontline health workers who have been working with patients from the start of the pandemic. So what would be your sort of like final thoughts, parting words for them? Go ahead, Boom.
I used to be a very decisive person. When I decide, it's quick. That's post-COVID. Now that I acknowledge the fact that I'm suffering from long COVID, my decision-making process has to take time. Whether I'm breaking up from my partner or signing a contract, I take a while. I think a lot. Is this the right thing to do? Have I exacerbated enough effort before I call it quits with someone? Or have I read the contract thoroughly before I sign it? Should I buy a new computer, knowing fully that my computer, though it lags sometimes, because sometimes I have to think a lot. Unlike before that, oh, this is my decision. And normally I decided correctly. But now I have to take a while because I recognize of the condition of long COVID. And to those who also have long COVID, fret not. Let us arm ourselves with notebooks and pens. Or we have notes on our cell phone. So nino-note ko doon lahat. So I asked the question, when will it end? I get the answer that maybe in 3 years, but that's no guarantee still. I pray a lot. You just don't know what my prayers are to God, especially when I wake up in the morning that I don't smell anything. To this day. Momentarily though. But to those who still do not believe, to my neighbors in Gulo at Cabuyao, Laguna, who still don't believe in the vaccine, please get vaccinated. And I'm hoping and praying that when I get my second booster, everything will be fine and dandy again. Hope floats. I will be well, very well one day. And thank you very much for this opportunity to share whatever I have in my brain. Thank you, thank you. I'm grateful.
Yeah, thank you very much. That's Büm Tenorio of the Philippine Star. And really, we are so grateful for your coming out, sharing, and affirming to our audience. And as I said, there are many disclosures on the chat of people who have felt the same way that you felt. And, more power to you as you continue to advocate for being open about this, because that's the only way we are going to be able to understand this. Okay, Jubert, go ahead. Your reaction, your parting words.
Yeah, as I've mentioned, long COVID is a real entity, no matter how we call it. So it's something real. It's something that's really bothersome to afflicted individuals. So I think there's still a lot of knowledge that we are grappling with in terms of how to manage this entity well. But I think COVID also allowed us to be kinder and to be more patient. And that's what we need right now, especially from frontliners. Thank you.
Thank you so much. That's Jubert Benedicto of Critical Care Unit of PGH. Okay, Nina, your turn.
So I'd like to just say that I think long COVID is like the next silent pandemic. So in the very conservative incidence rate of 1%. Kung 603 billion na yan nasa dashboard ng WHO, all confirmed to have COVID-19, that's still about 6 million people globally, diba? So as we see more and more higher percentage of this illness, kung naging 10%, for example, that's already like 60 million people. So talagang parang malaking burden rin siya sa atin. So together, let's try to recognize this silent pandemic and, help ourselves, our families, our patients, and our communities to try to cope, to understand, and to manage this entity. So to Sir Boom and all the long COVID patients, I will really pray for you. That's it. Thank you.
Okay, thank you so much. It's Nina Berba, head of the Infectious Control Unit of the Philippine General Hospital. Raymond, did you want to give some feedback on our evaluation before we call on our final speaker?
Okay, so for our webinar, at least 94% of our respondents said that they strongly agree with all of the statements. So it was very well received and very consistent. If you look at the chat, there are congratulatory messages and well wishes, especially for Büm Tenorio. So and many really believe that you are on your way to recovery, Sir Boom, and kaisa niyo po kami in your path to recovery.
Salamat.
So Dr. Susie, for our closing remarks.
Okay, so thank you so much. Closing remarks. Okay, none other than the Deputy Director of the Philippine General Hospital, Dr. Stella Marie Legaspi. Natamo, nakalimutan ko na yung Jose. Stella. Go ahead, Stella.
Good afternoon, everyone. I'm glad to be back to do the closing remarks. It's a very interesting webinar. We learned a lot from all the speakers. Mr. Büm Tenorio honestly gave his comments about his experience with COVID and his long COVID. The problems he experienced was loss of smell, which really bothered him. It lasted for 3 months. Sabi niya nga, phantom smell, forgetfulness, he couldn't remember names, and had difficulty writing his column. For a person who writes very well and the words just come pouring in, he had difficulty. He had sleeplessness, depression, and he was dazed. Okay, so that was a very honest discussion by Mr. Büm Tenorio. And for Nina, Dr. Nina Berba, our head of the Hospital Infection Control Unit, she observed her patients. They also complained of loss of breath, forgetfulness, and a nurse patient had a feeling of fatigue and extreme tiredness, which at first she thought was malingering, but really it was long COVID. And a 20-year-old female who had mild COVID, but turned out to have pulmonary problems, and the pulmonary test showed restrictive pattern. So what is long COVID? It occurs in individuals who are confirmed or probable COVID patients, and the symptoms persist 30 days after the initial after the diagnosis, no, after recovery. I'm sorry, and it extends beyond 3 months from the onset of COVID. The symptoms are short. Common symptoms are shortness of breath, fatigue, and cognitive dysfunction. So the other names of long COVID are post-COVID, long haul COVID, and the post-acute sequelae COVID. The 3 most common symptoms are, as mentioned earlier, fatigue, shortness of breath, and cognitive dysfunction. But in the lecture of Nina, she mentioned a lot of symptoms: fatigue, shortness of breath, difficulty of thinking, headache, feeling tired, fast beating heart, sleep disturbances, mood changes, joint or muscle pain, changes in the ability to taste or smell, sore throat, fever, nausea, diarrhea, feeling dizzy, changes in menstruation, and some say problems like infertility and rashes and hair loss. So really, it's like a gamut of symptoms. But why does it happen? It happens because there are levels, higher levels of cytokine biomarkers. They have a persistent immune activation. Kaya ang nangyayari, yung mga immune markers are high. Yan yung interferon gamma, immunoglobulin G, interleukin 10, interferon gamma. These are all immune activation. They are the biomarkers and they cause the symptoms of long COVID. Okay, the patients will report. Older persons are more prone to it, so they have more symptoms like brain fog, and some self-reported complaints. They have more neurologic complaints and pulmonary complaints, and almost all complain of fatigue. So when we see patients like this, let us not say that they are malingering, because they have the symptoms of long COVID. So it is more common depending on the age of the patient, if she's overweight, if she has history of asthma, and more common in females. And it is also common in patients with prior physical or mental health issues. Okay, so Dr. Jubert Benedicto, our CCU math head, he mentioned yung post-COVID, first nga 30 days after recovery, and the cutoff is 30 months, and 40 to 21 days. So as he explained, 14 to 21 days after the COVID, the virus is not anymore viable. So it's not alive anymore in your body. Okay, so but these patients, they still have the symptoms. And the risk factor for post-COVID, long COVID, is immunodeficiency syndromes like diabetes mellitus, hypertension, and smokers. Okay, so let us try to control our blood sugar and our blood pressure so that we will not get the risk factors. Now, the virus-stimulated inflammatory response, the patients will have fatigue, dyspnea, and bothersome cough. And when they undergo the chest X-ray or the CT scan, 50% resolve within 3 months, and 80% resolve 9 months to 1 year from the time of recovery. See, it's really a long process. And so he said, ito yung interesting, that this post-COVID or COVID unmasked certain illnesses. So may patient siya na nakita niya may bronchiectasis and may TB. It unmasked the tuberculosis. Okay, so ang mga test nila, cardiopulmonary exercise test, so yung cardio capacity, the cardio capacity, yung spirometry, 30 to 50% nagkakaroon ng decrease in their FEV1, and the individuals are more prone to exertional dyspnea. So dahil meron silang so they are given bronchodilators and steroids. So napapaigi naman ang ating mga pasyente. Pero what I liked really about his talk was, sabi niya, thank God for small blessings. You know, I also would say that to our patients. Thank God for small blessings. You survived COVID. And so may pag-asa yan. Think positive for your patients. Focus on healing. And do not compare yourself with others. Kasi iba-iba tayo. Huwag susuko, he said. And celebrate your milestones. Yan. Milestone yan. Naalala ko yung name ng student ko, Sir Büm. Milestone yan. And we congratulate you for coming forward for this talk. And so, ang sabi nga ni Nina, this thing will continue, no? Dahil millions and millions ang nagka-COVID. I just hope na, like Nina and I, we are both, so far, we haven't gotten COVID. Let's hope that more people will be vaccinated. And I think that's really the gist of it all. Thank you very much.
Thank you very much. That's Dr. Stella Jose, who's the Deputy Director of the Philippine General Hospital, for an excellent summary. Okay, so we are now coming to our end. I'd like to thank our two experts and of course Mr. Büm Tenorio for being here with us. And next week we will be talking about a very exciting topic, which is HIV, human immunodeficiency virus in women. Before the pandemic, we had the highest rate of growth of HIV infections in this part of the world. But apparently, this slowed down during the pandemic. But recently, people have been talking about HIV again because a huge percentage of, I think Nina mentioned this, that most of the patients who are at risk for monkeypox are actually HIV patients. And recently in the international news, they had a patient who had COVID, monkeypox, and HIV all in the same person. So we are going to talk about HIV in women and what this means for the Philippines. And so we hope that you'll join us. It's not about COVID, but my goodness, it's going to be a very, very exciting and interesting topic. So join us next Friday. Raymond.
Thank you, Dr. Susie. So again, we invite everyone, and hopefully you'll be able to invite your colleagues, your workmates, your friends, your families to join us next week for another exciting topic that we will be talking about. Not too many webinars focused really on HIV in women, but hopefully we'll be able to shine a light on this particular topic for next week's webinar. But before we conclude our program, let us first acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out quality content week in and week out. And finally, all of our Stop COVID Deaths webinars are archived for viewing. Just go to youtube.com/TVUPPH for you to be able to see all 115 webinars. And then after this one, it will be 116 na po. So this formally closes our webinar for the week. Magkita-kita po tayo again next week from 12 noon to 2 p.m. It's a date!
Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online!